You know, when we hear the term AI, our minds usually jump to things like self-driving cars or those chatbots we see everywhere. But today, we're diving into something way more personal, something that's truly changing lives. We're going to talk about how artificial intelligence is kicking off a whole new era of smarter, more personalized medicine for our youngest patients.
And this quote right here, it really hits the nail on the head. Dr. Tarek El-Barambalali reminds us that if you think AI is just about chatting with a robot, you're really only seeing the tiniest tip of the iceberg. What this technology can actually do is so much bigger.
So, that leads us to the big question for today, right? If it's not just about chatbots, then what is AI really doing in pediatrics? Let's get past the hype and take a look at how this stuff is being used in clinics and hospitals, like right now.
Okay, so yeah, chatbots made AI a household name, no doubt about it. But in medicine, its true power isn't about holding a conversation. It's about digging through mountains of data to find tiny patterns that are basically invisible to the human eye. So let's just make sure we're on the same page. What is AI, really? The simplest way to think about it is as a computer program that's built to mimic how a human brain works. It doesn't just follow a strict list of commands. It can actually analyze new information, learn from it, and help make some really complex decisions. And that is what makes it such a game changer in healthcare.
Probably the best way to get a grip on AI's impact is to imagine it as this powerful new toolkit for doctors. It's not just one thing. It's a collection of really amazing abilities that work together to give a doctor's own skills a serious boost. So, let's open it up and see what's inside.
Inside this toolkit, you've got four main tools. First, AI can understand language. I mean, it can read a doctor's notes or instantly summarize the latest medical research. Then you've got computer vision, which can analyze things like X-rays with a level of detail that's just wow. Third, it learns from massive amounts of data, spotting these super subtle patterns to predict what might happen with the patient. And finally, it uses deep reasoning to put all the pieces together, helping solve some of the most complicated medical mysteries out there. So, we've got the toolkit. But how does that actually help kids in a real clinic? This is where it gets really cool. This is where the theory becomes practice, and you can see the incredible impact it's having. One of the biggest, most immediate wins? It's the boring stuff, the paperwork. AI can handle scheduling, organize patient files, and even write down the conversation between a doctor and a family as it's happening. This frees doctors from all that administrative headache, giving them more time, precious time, to focus on what actually matters, taking care of their patients. And this leads to this incredible new way of diagnosing illnesses. It's been called a second pair of eyes, and I think that's the perfect way to put it. You still have the indispensable experienced doctor, of course, but now they have an AI partner that's analyzing lab results, growth charts, and medical scans, flagging tiny connections that even the best doctor might miss. It's not a replacement, it's a collaborator. And this is where we really start to move away from that one-size-fits-all approach to medicine. An AI can look at a child's unique genetic code and other personal data to help figure out which specific treatment will work best for them. So instead of giving every kid with the same illness the same drug, you can tailor the therapy to their individual body. For kids who are at high risk, care isn't just something that happens inside the hospital walls anymore. Think about wearable devices that monitor vital signs around the clock, 24/7, with an AI constantly analyzing that stream of data. It can alert doctors at the very first sign of trouble, letting them step in before things get serious. It's proactive, nonstop care. Now, AI isn't just about treating patients today. It's also about training the doctors of tomorrow. It's completely changing the game when it comes to medical education. Just imagine this. A doctor can ask an AI to quiz them on, say, a rare heart condition. And based on how they do, the AI creates a custom study plan just for them. It can whip up a summary of the latest research in minutes, create super realistic virtual patients to practice on, and give instant feedback. It's like having a tireless, brilliant personal tutor for every single doctor. I love this quote. It really gets to the heart of AI's role in education. It's like a guide, a mentor, a supportive resource that's always there for doctors throughout their entire career. It's there to provide information, double-check their thinking, and just help them get better and better. It's this nurturing force in their professional growth. So as we start to pull all these threads together, it becomes really clear what we're talking about. This isn't some sci-fi future full of robot doctors. Not at all. It's about a powerful, powerful partnership between human expertise and artificial intelligence. At the end of the day, the goal here is really threefold.
For the patients, it means better, more personalized care. For the healthcare system as a whole, it means more efficiency. And for the doctors themselves, it means they're empowered with better tools for diagnosing, treating, and learning. It just makes them better at what they do.
All right, so let's wrap up with the key takeaways. First, AI is a real, practical partner for doctors today, not some far-off dream. It's delivering real value by saving time, making diagnoses sharper, and personalizing care. And as we use these amazing tools, this second pair of eyes and personal tutor, we have to remember that ethics and protecting patient privacy are absolutely crucial. That's the foundation for all of this.
In this might be the most important point of all. The future isn't about AI replacing doctors. It's about doctors who use AI becoming far more effective than those who don't. For anyone in the medical field, learning how to leverage this technology isn't really an option anymore. It's essential to staying on the cutting edge of medicine.
And that kind of leaves us with one last big question to think about. As this incredible partnership between human doctors and AI keeps growing and evolving, what's healthcare going to look like for our kids and for their kids? The potential is just massive. And honestly, we're only just scratching the surface. Thanks so much for joining me.